P53, it is a tumor suppressor protein. It is also a DNA binding protein. DNA binding protein, its functional regions can be divided into the N-terminus, the middle region, and the C-terminus. The N-terminus has a transactivator domain. The middle part is the DNA binding domain that interacts with DNA. The C-terminus helps in forming a tetramer. I remember the teacher mentioned before, when P53 starts to work, it forms a tetramer. Its C-terminus also binds to DNA telomeres. Later, in the next unit, we will also discuss its binding to DNA telomeres and how it regulates DNA aging. Previously, some DNA viruses were mentioned. After they infect cells, they can inhibit the functions of some tumor suppressor proteins. Apart from RB, which the teacher just introduced, they also bind to P53, inhibiting P53's ability to bind to promoters. P53 interacts with some coactivators or transcription factors through its N-terminus, such as TBP or P300, to enhance its transcriptional efficiency. In many cancer cells, the mutation rate of P53 is highest in which part? Guess if it's the N-terminus, the middle, or the C-terminus. The answer is the middle DNA binding domain. The three main tumor-suppressing functions of P53 were mentioned before. It induces P21 and P27 to signal the cell cycle to pause. In addition, it is a DNA binding protein that can bind to some repair proteins, such as GAD45. It expresses repair proteins to maintain the stability of the entire genome. Additionally, aside from promoting cell cycle arrest, sometimes it can lead cells toward apoptosis. These DNA viruses produce oncogenes, which integrate into host cells, and the resulting tumor suppressor proteins interfere with the host cell's nucleic acid repair capabilities or inhibit the functions of tumor suppressor proteins. For example, the large T oncogene produced by SV40 can bind to the tumor suppressor protein RB in host cells. Additionally, E6 and E1b can bind to P53, resulting in the loss of these tumor suppressor functions, causing excessive proliferation of host cells. Next, the teacher will introduce P53. The P53 protein, under normal conditions, has a half-life of only about 15 minutes. It is known as a so-called hit-and-run protein. Its half-life is very short. Students must be wondering, teacher, this tumor suppressor protein is so important, shouldn't its half-life be longer? Because it has to work, but no, its half-life is very short, only 15 minutes. However, when cells encounter adversity, such as DNA damage or excessive expression of oncogenes, it triggers P53 and can cause P53 phosphorylation, increasing its stability. It's like when I encounter a situation, that superhero normally is like a news reporter, but when a situation arises, he quickly changes into that superhero outfit. P53 does the same. It increases its phosphorylation and thus increases its stability. At this point, phosphorylated RB will have a longer half-life, and it will be more stable. It can signal the cell cycle to pause, induce repair, or if during the G2 phase the damage is severe, it can tell the cell to quickly undergo programmed cell death. So who phosphorylates P53? This is called ATM. Every time I introduce ATM, the students' eyes light up. ATM like an ATM machine? No, ATM is a DNA damage sensor. What does it mean to be a DNA damage sensor? That is to say, for example, when you go to a meeting hall, there's a fire or smoke detection device. When it senses smoke, it indicates a possibility of fire. ATM acts as a detector. When DNA is damaged, it says, hey, my DNA is damaged. Quickly phosphorylate P53. That superhero must quickly transform. At this moment, P53 will not bind to MDM2. MDM2 is an oncogene that destabilizes P53. At this time, phosphorylated P53 gains stability, not binding to MDM2. Returning to ATM, it is very important. It senses DNA damage and tells P53 to execute cell cycle arrest or nucleic acid repair capabilities. If the ATM gene is defective, it leads to a condition known as ataxia telangiectasia, or also called Lewy Body syndrome. Typically, patients with this condition will experience disability and dementia with microvascular dilation and an impaired immune system, making them more sensitive to ionizing radiation. Additionally, they may experience cerebellar ataxia, which causes them to walk unsteadily. In severe cases of muscle incoordination, they may have a very high likelihood of being wheelchair-bound for life. Moreover, due to immune system disorders, the risk of developing other cancers is also higher. The disease of cerebellar ataxia is most commonly detected in childhood, with patients potentially developing symptoms between ages 3 to 6, combined with immunodeficiency, microvascular expansion, and increased sensitivity to cell death caused by radiation. They also exhibit abnormal resistance when DNA replication is paused due to radiation. It is located on the Q arm of chromosome 11. It is a kinase, which phosphorylates p53, especially when DNA is damaged. It acts as a sensor, telling p53 to phosphorylate, increasing its stability and starting its function. ATM has at least 4 variants, including ATM and mutated genes A, T, A, C, D, E, located at chromosome 11q23, with 400 variations. When mutations occur, it leads to abnormal cell cycles, chromosomal abnormalities, and DNA breaks, making it more sensitive to ionizing radiation. The incidence is higher in the United States and the United Kingdom. Due to cerebellar ataxia, as it gradually degenerates, muscle atrophy occurs with feelings of weakness. The movements of the eyes also become impaired, and there is microvascular expansion. Between ages 2 to 8, the eyes, conjunctiva, and the skin's microvessels may expand. The immune system is dysregulated, leading to recurrent sinusitis or lung infections. They exhibit hypersensitivity to radiation therapy, resulting in excessive reactions and an increased likelihood of developing lymphomas and leukemias. ATM is very important. It tells p53 to phosphorylate, preventing it from binding to MDM2. MDM2, in turn, binds to the N-terminus of p53, leading to p53's degradation and inhibiting its transcriptional function. So why do we say p53 is a hit-and-run protein? Because it binds to MDM2, inhibiting its transcriptional function and causing its degradation. Do students know the concept of one counteracts another? MDM2 influences p53, but the cell, if it affects p53, needs a molecule to counterbalance it. This molecule is called ARF, or P19. Within the cell, there is a well-known tumor suppressor gene locus, which produces 2 tumor suppressor proteins due to automated suppression. One of these tumor suppressor proteins is called P16. P16 shares functions similar to P21 and P27. They all act as CDK inhibitors, suppressing the activity of CDK4 and CDK6, preventing CDK4 and CDK6 from phosphorylating RB, thus pausing the cell cycle. During the G1 phase, nucleic acids can undergo repair. The other one is called P19 or ARF. These 2 names are akin to having your own nickname. When ARF binds to MDM2, MDM2 can no longer bind to P53. At this time, P53 stabilizes, allowing it to help pause the cell cycle. Thus, this gene locus is extremely important. When NK4A ARF mutates, its tumor-suppressing function will disappear. The teacher just spoke about the concept of one counteracts another. MDM2 inhibits p53. It binds to p53, degrading p53 and inhibiting its transcriptional function. The teacher likens MDM2 to a mantis, while p53 is like a cicada. That mantis catches cicadas. Have you heard of the mantis stalks the cicada? The next line is, while the cicada's unaware, the oriole waits. Isn't that right? The oriole represents the role of ARF. p53 can lose its function under several circumstances. First, mutations occur in its DNA binding region, preventing it from binding to DNA and promoting gene transcription. It may be unable to form a tetramer, as the teacher mentioned earlier. It requires 4 units to work. It gets infected by a virus. What kind of virus? The teacher mentioned some tumor viruses. The oncogenes they produce bind to p53, for instance. The large T of SV40 binds to the DNA binding domain of p53, inhibiting its function. Additionally, when MDM2 expression is higher, the mantis is more numerous, eating the cicada, leading to 53's degradation. At this time, p53 will also lose its function. Next, the teacher will pose a question. When MDM2 is expressed in large quantities, it causes 53 to lose its function, inhibiting it, making it unstable. ARF, the teacher describes, is like the oriole. The mantis catches the cicada while the oriole waits. Let's examine their relationships. ARF catches MDM2, which degrades p53. The teacher wants to ask everyone a question. Which situation would cause 53's activity to decline, meaning the cicadas would decrease? First, there's no MDM2, no mantis. Secondly, MDM2 increases. There are many mantises. Thirdly, there's no ARF. Fourthly, ARF increases. In what situation do cicadas decrease? Please answer 5, 4, 3, 2, 1. We will soon see the answer. The answer is 2. When MDM2 increases, there are many mantises, and they eat the cicadas. Without ARF, there's no oriole. Without the oriole, the mantis has no natural enemy, so there are more mantises. Of course, the mantis will eat the cicadas. Thus, P53 may lose its activity when MDM2 is more abundant and when ARF is absent. Today's take-home message is that RB is a tumor suppressor protein that regulates cell cycle progression. Non-phosphorylated RB remains in the G1 phase. Phosphorylated RB progresses from G1 into the S phase. P53 is a tumor suppressor protein. Its function is to inhibit the cell cycle and induce apoptosis. P53 induces the expression of P21 and P27, causing the cell cycle to pause. If RB is not phosphorylated, it continues to bind with E2F, keeping the cell cycle in the G1 phase. In many cancer cells, the mutation rate of 53 in the DNA binding domain is higher. Now, regarding tumor suppressor proteins, do RB and P53 make sense to everyone?